What is lotus birth? Lotus birth, also known as umbilical non-severance, is the practice of leaving the baby attached to the placenta until the cord naturally dries and disconnects from the belly button. This process generally takes 3 to 10 days, but can vary depending on climate and humidity levels. Lotus birth is about keeping the umbilical cord and placenta with the baby while he or she gently transitions to life outside the womb. It is a quiet and respectful transfer of attachment without the trauma of being cut from the mother. So one particular goal of lotus birth is to minimize and reduce the trauma of childbirth. Everything is sensory overload for a new baby when they're coming into the world. From breathing oxygen to hearing distinct sounds, seeing bright lights, to feeling clothes on their skin. Everything is new. So the first thing that we do when they get here should not be to sever their connection to the one thing they've been connected to since the beginning of their time. It's not fair, and it can really be the first gift of autonomy that we give to our children, and letting them make that decision for themselves. And when they feel safe and secure and well nourished, they will release their cord. So that's just another benefit to the lotus birth. What's in a name? The name comes from the lotus flower, a flower important to Eastern culture for its symbolism of unity, detachment, and rebirth. Lotus births speckle the history of childbirth in cultures around the globe, in places like Bali and southern Africa. Historical traces of lotus births appear in Europe as early as the Middle Ages, and records of not cutting the umbilical cord appear on the American continent as early as the pioneer days. In Western nations, lotus birth seems to be a new birth trend steeped in early tradition. There are other reports of the name stemming from events in 1974, when a pregnant Californian woman named Claire Lotus Day learned about the behavior in chimpanzees and began to question why humans don't do it. That is what started the trend of the lotus birth. But women have been doing lotus births since the beginning of time. If you just think, like back in primitive times, do you think they were severing the cord with rocks or spears? Like, this is something that is maybe new in Western society, but it is very old in other regions of the world. So don't be fooled. It has been said, until the lion learns to write, the tale of the hunt will always glorify the hunter. And so we must be wary of official narratives as it pertains to the erasure of Black women. Black women are the original woman, the first race of women. There's nothing new under the sun, and everything as it pertains to birth, we did it first. The medical institution just doesn't like to give credit where credit is due. So please know that this is not new. This is ancient wisdom, and many of us are remembering it as it has been coded into our DNA, and that is why we do it. It is not because it is trendy or just a fad or something new and exciting, like they refer to it as new agey, and it's definitely not that. The first records of cutting before placental delivery hail from the 17th century. The rationale behind it: in 1968, a man named M.C. Botha examined the early literature on cord tying or clamping from 1668 onwards. The neonatal tie or clamp was initially employed to avoid blood loss from the baby before physiological closure of the umbilical vessels. 2 other reasons have emerged for clamping the placental side of the cord: to identify when the cord lengthened, indicating separation of the placenta, and in order to spare the bed linen from being soiled by placental blood leaking from the cut end of the cord. Both stated that the reasons given for the practice were not sufficient to justify clamping. Now, please note that interventions have somewhat of a snowball effect, meaning the one thing that someone does to intervene into your birthing experience will likely lead to another intervention. In this case, it is with the emergence of male midwives, and then later male obstetricians and gynecologists, and their influence and impact in the birthing industry, where women are now laying on their backs to give birth instead of walking and moving and squatting or on all fours. They are defying gravity to push a baby up and out for the comfort of their deliverer, so to speak. But that intervention necessitates the manual removal of the placenta in some cases because it does not naturally detach as it would if women were left to their natural devices. Another example of a self-fulfilling prophecy as it pertains to birth in the hospital is the whole notion that pregnant women or laboring women are not supposed to eat because in the event they go to surgery, their stomach contents should be empty. Now, when you are getting ready for labor, you need to be eating like you're preparing for a 50-mile marathon. So you're actually being malnourished when you're in the hospital. And that often leads to the lack of stamina or endurance necessary to have a natural birth, which then leads to them intervening. So they create problems and then swoop in to save the day. But really, they're just solving problems that wouldn't otherwise exist if they hadn't intervened in the first place. However, the practice quickly became routine despite similar warnings from eminent minds of the day. In 1773, Charles White wrote that the common method of tying and cutting the navel string in the instant the child is born has nothing to plead in its favor but custom. In 1801, Erasmus Darwin wrote, "Another thing very injurious to the child is the tying and cutting of the navel string too soon, which should always be left till the child has not only repeatedly breathed, but till all pulsation in the cord ceases, as otherwise the child is much weaker than it ought to be." His theory was verified by the crude but illuminating experiments of Boudin, who, in 1875, measured the volume of blood retained in the placenta after early clamping, concluding that about 1 liter was denied to the early clamped neonate. More recently, cord blood is increasingly being collected for stem cell storage in both public and private sectors. Future theoretical stem cell developments have prompted some parents to opt for cord blood banking, which became a for-profit business at the end of the 20th century despite persistent clinical uncertainties and ethical debate. Collecting adequately large volumes of cord blood for banking relies on early clamping and potentially distracts the practitioner from patient care. These factors have led professional bodies to take a precautionary approach. Nevertheless, lack of knowledge, the strong influence of tradition, and the modern practice of umbilical cord blood banking keep the practice popular. Listen, cord blood is highly profitable for the institution. Their goal is by all means to keep the cord, blood, placenta, and everything else they label medical waste for profit. It is all actually extremely valuable to them. They honestly should be compensating you for it. The priority is not what's best for you and your baby, it's what's best for their bottom line. They represent their interest, you must represent your own. Now, with all major decisions, it is important to weigh the cons and the pros so that you can determine if this is a good choice for you and your family. I will go over the cons and the pros below. Infection. As a decaying human organ filled with blood, there are bacterial overgrowth risks if not properly cared for. Parents who choose LOTUS birth should monitor their babies. If the cord has been torn or damaged during birth or C-section, a LOTUS birth is not safe. Blood stops circulating to the umbilical cord and placenta within minutes of leaving the womb. Once fresh blood is no longer circulating to the tissues begin to die as well as rot and smell. As that happens, the placenta can become colonized by bacteria and potentially become infected. If the placenta and baby are still connected via the umbilical cord, the infection could easily transfer to the baby. Be sure to prepare yourself mentally and physically for the task of properly handling and care of your placenta, and the probability of infection is low, so please don't be scared. Number 2, you can't have your placenta and eat it too. While not necessarily a risk or a con, this does stop women from choosing LOTUS birth. If you plan to consume or encapsulate your placenta, a LOTUS birth is not for you. Inconvenience. You really should not be going anywhere with the infant and his or her placenta. It's not a very fashionable or practical accessory, plus travel can increase the risk of infection. That's pretty much it for the cons list. Moving on to pros, the umbilical cord clamping can be detrimental to the newborn, leading to an increased risk of anemia and, in the premature infant, an increased risk of intraventricular hemorrhage and respiratory complications. Delaying clamping in preterm infants decreases the need for blood transfusion, which comes with a whole other host of risks. Blood transfusions have been associated with neonatal necrotizing enterocolitis, which is a condition that causes intestinal tissue to die. It can also cause a hole in the intestine. Bacteria can leak through this hole, causing serious abdominal infections and death. With the LOTUS birth, you don't have to worry about that risk. In the term infant, delayed clamping improves neonatal oxygen transport and red blood cell flow, and in premature infants, it is associated with fewer days on oxygen and ventilation. Delayed cord-clamped infants have a higher respiratory rate and a lower relative risk of developing infant respiratory disease. If premature, they are less likely to require resuscitation and respiratory support and may also obtain protection against respiratory distress syndrome, intraventricular hemorrhage, and sepsis. Hands down, a LOTUS birth has the quickest recovery time, ranging anywhere from 1 to 10 days. When the umbilical cord is severed at birth, it typically leaves an open wound at the navel that you still have to treat and care. Be careful around diaper changes. You're not able to submerge the baby in water, and with the LOTUS birth, that is simply not the case. And during that 1 to 10 day period, when the cord detaches, the navel is fully healed. I have done 2 LOTUS births, and with my first daughter, it took 4 days, and with my second baby, it only took about a day and a half. So, yes, hands down, quickest recovery. Another benefit is that baby gains all of the blood volume, which would otherwise be stolen by the hospital, which is about 40 milliliters. That is a lot of blood for a newborn baby. Baby gains stem cells and vital nutrients from the cord blood, which aids in reparation and virtually eliminates the need for a vitamin K injection at birth. Very briefly, I just want to talk a little bit about vitamin K and what it does. Vitamin K is not a vitamin. It is a blood coagulant that thickens the blood, and its intent is to keep a baby from bleeding out should they suffer any trauma. Well, trauma in childbirth is totally normal. Sometimes babies have shoulder dystocia, and maybe their shoulder gets stuck in the pelvis. Sometimes, babies' heads are squeezed as they're going through the birth canal, and there could be some bleeding going on somewhere within the body. Our bodies naturally produce vitamin K after about 8 days of life. That means the innate wisdom or the internal intelligence that runs the show, that conceived your baby and grew your baby and birthed your baby, is deciding that baby should produce vitamin K 8 days after birth. What this does is gives the stem cells from the cord blood enough time to travel up the spine and go to any places in the body that needs to be repaired. Now, if vitamin K is injected at birth, that creates a more sludgy type of molasses blood in the body, whereby making the stem cells, giving them a very difficult path to travel, making it very hard for them to move through the body to get to where they need to go to repair any damages or traumas that occurred during childbirth. Overall, this is just a more holistic approach to mother and baby wellness and a slower integration into society. So this is an excellent opportunity to just be still and bond with mom and dad and baby and whatever other family you have in your home that needs to bond with baby when they initially come into the world. It is not a time to have several visitors and co-workers and friends, because you do have an open organ still attached to your baby that you need to be mindful of, and it is an excellent excuse to not get up too soon, to not go anywhere too soon, and to not have those unwanted visits and drop-bys. So that for me was a definite pro. And also it can be somewhat of a first milestone or a gift of autonomy to your newborn by giving them this chance to let go of their placenta instead of severing that connection and making that decision for them. The mounting evidence for deferring clamping has prompted changes to recent guidelines. The World Health Organization has finally and officially endorsed the practice of so-called delayed cord clamping. The International Federation of Gynecology and Obstetrics and the International Confederation of Midwives have also removed early cord clamping from active management guidelines. I share this information because I'm a hardcore advocate for informed consent. We simply don't know what we don't know, but the more we know, the better we can do. How to have a successful LOTUS birth. Number 1. Clear and concise planning. Be sure you're on the same page about the definition of delay with your medical institution. Number 2, specify in your birth plan a time frame. Don't just say until it stops pulsating. Say 59 minutes and 59 seconds, or 24 hours, or not to be severed at all. Allow it to come off naturally. Just be specific. So take a look over here at table 1. If you go all the way down to the most recent trial from 2006, it says Mercer, you'll see that the definition of early clamping is 5 to 10 seconds, and the definition of late clamping is 30 to 45 seconds. That is why I say you must be very specific in the amount of time that you want and what you can do. Even if you intend to cut the cord after a certain period of time, tell them that you don't want to cut it at all, to ensure that your baby's actually able to get all of the stem cell and the vital nutrients, and their cord is actually able to stop pulsating, because they will snip very quick. As you can see, their definition of delay is not much of a delay at all. And I have been in the delivery room with a birthing mother where she is telling them don't cut the cord, I'm telling them don't cut the cord, and they go ahead and clamp. Here's a general idea of what to expect. When the baby is born, the umbilical cord is left alone while the mother delivers the placenta naturally without Pitocin. Once the cord stops pulsing, the placenta is generally rinsed with warm water and gently dried with an organic absorbent cloth. It's then left to drain for approximately 24 hours. Must be warm water. Never use cold water. Please write that down. The placenta does require regular maintenance to prevent infection. Some place the placenta in a basket or pot and liberally cover it in rosemary powder or sea salt, adding as needed. Others do this but store it in a cloth diaper or a placenta bag. Containers should be changed and cleaned daily. Baby is usually dressed in loose clothing to facilitate air circulation and to reduce tugging until the placenta and cord naturally detach from the navel. Now here are a couple of images of a healthy placenta after birth. From here, the placenta needs to be washed in warm water and all blood clots removed. I have done a LOTUS birth in a hospital and a LOTUS birth at home, and in the hospital, the medical staff were extremely petty. They fought me tooth and nail on doing a LOTUS birth, and when I stood my ground and was very adamant about it, they refused to handle the placenta at all. I'm not sure how it would be for you, but please be sure to be prepared mentally and physically to take care and handle your placenta and do everything that needs to be done, from initially cleaning it, removing blood clots, and then also in bringing the materials you may need, such as an absorbent cloth and Himalayan sea salt and different herbs and things that you may want to use to keep it dry and smelling fresh. In my personal experience, we never had any foul odor or signs of decay. The placenta was healthy and it maintained that health throughout our entire experience. My husband changed the dressing often, kept it dry, replaced the herbs as often as necessary. Don't be scared to handle your placenta, y'all. This is a part of you. This came from you. Honestly, if you think about if you handle raw chicken meat and ground beef and things like that, and you can wash it in the sink, this is just flesh from your body that has been sustaining your baby, and it's no big deal, honestly. The beautiful thing about home birth and delivery is that you totally get to call the shots, and Older siblings and other members of your support team can be as involved as much or as little as you would like. So here you see my older daughter helping my husband add the salts and the herbs to the placenta for care, and she was so ecstatic to be able to help out with her new little sibling in that way. You'll definitely notice how your cord changes over time. Right at birth, it is soft and jiggly, squishy, really malleable, and as baby receives all of the blood volume, the stem cells, the vital nutrients, the cord dries out and hardens. It gets really thin and wispy, but it does not break. It is very strong. But it does change over time, and here you can just kind of see how it went from being really wet and squishy to really, really thin and narrow. Here's a photo of my beautiful Lotus birth babies when they were 3 and 5. So you can see that they are alive and well, healthy and thriving, and just as beautiful as they want to be. Thank you so much for listening and joining us for this PowerPoint. I hope you learned a lot. I am here for any questions that you may have. I will link my email below if you want to further discuss my experience, or you want to see how this could potentially look for you and your family. I am here to help you come up with a specific plan for your individual needs. So, yes, I love what I do, and I look forward to creating more content for you.